Thanks, Liz and WKRC. There's an unexpected consequence of the pandemic, a coin shortage. Business owners are now left asking for loose change or cards only. Joining me now is Dr. Dena Grayson. Dr. Grayson, tell us a little bit about this. And I fully understand this, but I want you to explain it. What's going on? Why aren't people using coins?
Well, Eric, people are concerned about those coins. You get change from somebody. Who just touched those coins? And they're worried about actually catching coronavirus. I think that people are taking precautions. It's a wise thing to do, basically to have sort of touchless paying methods, or where you only touch your credit card and not money. Obviously, some people need to use cash, and that's fine, but wash your hands, don't touch your face. So that's really what's happening here. And as a consequence, unfortunately, we also had the pandemic shutting down the mint. So we had this reduced production of coins with, coupled with this decreased circulation of coins, because people are appropriately trying to avoid touching, foreign objects, if you will.
Makes a lot of sense. And the reason why the government is asking you to continue to circulate our coin currency is because it costs them, in some cases, certainly the penny, possibly the nickel, it costs them more to produce a penny than a penny and a nickel than a nickel. So they want to keep it moving, because if they have to keep producing it, you could basically hoard your coins. What about paper currency?
Well, Eric, unfortunately, the same thing goes for paper. It does appear, there was one study published several months ago, that perhaps coronavirus doesn't last as long on paper versus metal objects. But even still, if you go to a cashier and somebody's handing you paper money that somebody else had just handled who was infected with coronavirus, that could pose a potential risk. I do want to point out, though, that most of the spread does occur to be happening through the air, person-to-person contact through the air. But still, people should take appropriate precautions.
All right. Well, Doc, then let me ask you this. From the very beginning, they've told us it's okay to go pick up some food from a restaurant on takeout, but what's the difference between a dollar bill and the packaging you hold when someone hands you a paper bag?
Eric, that's a great question. And in fact, what I've advised people for many months to do is, as soon as you get home, as soon as you break that coronavirus-free bubble of your home, you have to assume anything you touch could be contaminated. Every person you cross could be infected. So when you get home, you want to take the contents of your takeout, pour it into your own clean bowl or plate or however you're going to eat, throw the packaging away, and wash your hands and wipe down the counter with soap and water. That would be the safest way to go. So there are ways to get takeout and do it reasonably safely. And it's certainly a lot safer than sitting inside, of course, indoors and dining without a mask.
Very quickly, about a minute or so, Doc, Dr. Birx had said we're entering a new phase of the coronavirus. I think you predicted that. I'm pretty sure you predicted that. Do you think this new phase will push us, and you did before, will push us into another, mandatory quarantining?
Well, Eric, we're sort of slowly heading in that direction. We've seen a good downturn, at least appears, in the number of new cases. But that's really a consequence of people wearing masks and staying home. But now there's this big push to reopen schools. And we saw what just happened in Israel. They reopened their schools, and they're warning us, don't do it. They had the largest outbreak probably in the entire world in Jerusalem because of a school that reopened.
But Doc, will it ever get any better? And in other words, we can talk about not going back to school or not going back to work or not voting in person, but if we don't ever do this, aren't we going to be chasing our tail forever, just realizing we're never going to get herd immunity to the point where we can go do things again, or a vaccine?
Well, I think you nailed it, Eric. It's really a race for the vaccine. And in the meantime, what you try to do is limit the number of infections. Because what happens is those infections start in younger people, but then they spread to your older, more vulnerable folks. And those are the ones that really have that high chance of dying. And we're trying to buy time to get those vaccines available. The data so far look very, very encouraging for one or more of the vaccine candidates. And, I called for this many months ago, and including here on your show, Eric, is that, to ramp up production of those vaccines far in advance of having the clinical data. And that's exactly what's happening. So we do have a shot sometime early next year, potentially, of starting vaccinations. But, everyone cross their fingers, say a prayer, because we've got a lot of these vaccine candidates with data coming later this year.
All right, Dr. Dena Grayson, as always, good to have you on, clearing a lot of things up. Don't touch your coins or your cash. I'll talk to you next week, Dr. Dena.
Thanks, Eric. See you next week.